Hello, my name is Dr. Ashley Warner. I have a family practice here in Orange, Massachusetts. So I went to medical school in Chicago at Northwestern University Medical School, and I did college in Rhode Island at Brown University. I came back to New England after having grown up in the Midwest because of my family roots here. My father's family came over from England to Ipswich, Massachusetts in the 1630s. And my mother's family came over from England to Portsmouth, New Hampshire in the 1630s as well. So I have a foot in New Hampshire and a foot in Massachusetts. So I became interested in medicine when I was in college. I loved the sciences, but I did not want to work in a lab. I loved working with people and all the volunteer work that I did. And so when I came into medicine, I originally was going to be a surgeon, but then I stepped out for a few years to raise 5 children. And coming back into medicine, I decided to use that experience of raising a family and being in the community, and went into family medicine. So at this point, I really love having an entire family in my practice. It's wonderful to have a whole family to work with and to have them all work together and making better lifestyle choices. I like encouraging people to be healthy rather than just asking them to take medicines. And I particularly like working with my seniors and older population, and that seems to actually be my very special place, is the senior population. So during the COVID pandemic, I have been following a lot of the positive coronavirus patients who've been tested at our facilities and making sure that they have all the medical care that they need. And I've been doing that using telehealth. And when I go back into my office, which I'm looking forward to do, first at 450 West River, which is in Orange, and then we will transition to our new building in the TD Bank building across from the Cumberland Farms in downtown Orange. I will continue doing telehealth for any people or conditions that it's useful for, but we will also see patients in the office. And I'm looking forward to seeing people again in the office. I would like to give a couple of tips for my patients to try to keep you well. We only have a few things right now to keep you from getting coronavirus, and they are social distancing, staying 6 feet apart from people. They are good hand washing or using hand sanitizer, and wearing a mask, but using the mask the right way. And last week I had 4 patients who ended up sick with coronavirus because they touched their mask the wrong way. And we need to remember that the mask is there to screen out the coronavirus, so you have to think of it as having coronavirus. So you don't want to touch the front of the mask, you only want to touch the side of the mask. And when you put it on and off, you want to wash your hands before and after so that your hands stay clean and you stay healthy.